This is a live town hall meeting on the Affordable Care Act. How does Obamacare affect your small business and the insurance benefits you provide your employees? Presented by Arches Health Plan, the way healthcare gets better, and by Fringe Benefit Analysts, simplifying the Affordable Care Act for you and your family. Now, the host of tonight's live town hall meeting, Rod Arquette.
And good evening, everybody, and welcome to our live town hall meeting, the second in our series of 3 live town hall meetings that we're having on the impact of the Affordable Care Act. And now, the last month, we had an opportunity to basically do the ins and outs, what we would call Obamacare 101. We answered, the individual questions and how it affects individuals. Tonight, we're actually talking about the impact on small business. Small business, as many of you know, is the backbone of this country. There are, hundreds of thousands of small businesses across the country, many here in Utah, and they are going to be impacted by this, and that's what we're talking about tonight. The idea here tonight is really not about politics. I talk about politics of Obamacare on the show each and every day. What we're doing tonight is answering your questions, answering basic questions. If you're a small business owner, how, in fact, is it impacting you? Now, for this entire hour, we have limited commercial announcements. We've changed things because we really do want to hear from people tonight. So we have limited commercial announcements during the complete hour. And we invite all of you, those in the studio audience tonight, those listening on the way home tonight, to give us a call, 888-570-8010. You can text us at 59570 or email us at rod@knrs.com. So there are a lot of interesting things out there about the Affordable Care Act and its impact on the individual. Let me introduce you to our panelists tonight. To my left on your radio, to my left as well, Robin Sellers. Robin is an account executive with Fringe Benefit Analysts. Robin, how are you? And welcome back to the show. Great to have you on again.
Thanks for having me. I really appreciate it.
And 2 new panelists tonight. To my immediate right is Andrew Croshaw. Andrew is a partner and managing director at Levitt Partners. Andrew, welcome to the show. Thanks for being here tonight.
Good evening. Thank you.
And as well, we have Nathan Johns. Nathan is the chief financial officer with Arches Health Plan. Nathan, welcome to the show.
Thanks, Rod. Glad to be here.
Let me start off tonight in asking all of you to weigh in on this tonight as we consider and we talk about small business, its impact on healthcare. I want to start with you, Robin. I know you deal a lot with small business. What are some of the common questions, common concerns you're now hearing from small business?
Right now, the main concern that is on everyone's mind is price. Price is definitely being affected. There are several factors that impact it, and it doesn't impact every group the same way. So there's a lot of unknowns out there. But also, a lot of groups have confusion with the federal marketplace and how their small group plan fits into that and the penalty, and there's just general confusion for the employees.
All right. Let me ask the same question to you two gentlemen as well. Andrew, what are you hearing?
We are seeing a lot of businesses asking themselves the question and examining the compact that they have with their employees. Does this law fundamentally change the relationship that employers have with their employees when it comes to providing health insurance? And there's businesses like individuals are trying to make sense of the law and begin to think through the answer to that question.
Nathan, what about you? What are you hearing from small business out there?
I agree with what's been said already. The small business owners are looking for a solution. There's a lot of small businesses who currently offer insurance, and they're very concerned about price. Can they continue to do it? There's a lot of business owners who have never been able to offer health insurance because of price, and they want to know what can they do for their employees, whether they're offering insurance or whether they help them get to one of the federal exchanges to buy a policy.
Let me ask you, as those questions start coming in, there are many things that small business can do, but what are you recommending are some of the first steps that small business can do right away? And let's start with Nathan.
My recommendation is talk to someone who knows what the options are and determine what options you have. Doing that can be calling your broker, reaching out to them, doing some research on the different websites that are available, or talking to one of the carriers that's there. They certainly would love to talk to small business owners and what they can do to help them get answers.
Andrew, how confused are they?
This is a complex new government program with lots of interdependencies and factors that are going to weigh into the answer to the question people have about what should I do about insurance for my employees. And so I think we're going to watch businesses, for the most part, just watch this unfold. Those that provide insurance today for their employees, if they're smart, they'll do exactly what Nathan said and find a broker that's knowledgeable that can talk them through things. Those who aren't providing insurance today will probably do the same thing. But I anticipate that 2014, for many employers that are providing insurance, will be a year of monitoring the situation. 2015, we could begin to see some rather significant changes in the relationship that employers have with employees once they've watched this unfold for a year.
Okay, so 2014, an important year. 2015, another important year to be aware of as well. Robin, let me ask you, what are you hearing from small business out there?
I hate to keep going back to pricing, but unfortunately that's usually the number one concern of every group. And the unfortunate situation is the market is shifting. The individual pricing versus group, which is cheaper for me? Should I, go on the shop exchange or send my employees to the marketplace? Really what it takes is you need to look at every option and consider alternatives that maybe you hadn't thought of before. And because of the market shift, even if parts of healthcare reform are appealed or reversed or delayed, the shift has already happened, and there are already new products out. There's already new theories and strategies, and all of those should be exercised annually.
Let me ask you, what options right now? I mean, if you're a small business owner right now, are there some things, are you out of compliance already? You may have missed some deadlines already, or are they still to come? Andrew, what are some things that small business needs to be aware of right away?
Well, businesses that are below the threshold of 50 full-time equivalent employees won't be facing any new penalties in 2014 if they aren't providing a certain standard of insurance to their employees. So for those businesses, they aren't under the gun to make a decision. Businesses above that threshold, however, are going to be responsible for providing an adequate level of insurance to their employees, or they'll be facing a fine under the law. Now, recently we saw the administration roll back the timing for the implementation of that fine for 1 year. They didn't roll back the responsibility to provide that coverage, but the actual collection of the fees was delayed for a year. So those businesses, too, have a little bit more urgency than small businesses to figure this out.
Nathan, how about the typical mom and pop shop, and they may have 2 or 3 employees there? Will they face a penalty if they don't offer health insurance? They may or they may not now, but if they don't, will they face penalties?
No, there's no penalty for the small mom and pop shop. There's not one that's even contemplated in the future for them. Just as Andrew said, if you're under 50 employees, there are no hard and fast deadlines, and there are no penalties right now.
Okay, but if they do want to offer now insurance, if they're hearing about these exchanges and everything else, can they do that, and what are some of the things they need to be aware of?
If they do want to offer insurance, now's a great time to be looking at it. Here in the state of Utah, we have Avenue H, which is our own small business shop exchange. They're live and functioning. You can start shopping there today, which is a great way for small business to buy their products. If I'm not mistaken, Andrew, you at Levitt Partners use Avenue H here in the state.
Yes, that's correct.
And so that's one option for people, and then talking to your broker is another. Your brokers can help you get quotes from the various carriers within the state.
Let me ask you, Robin, I know you deal with small business as well on a lot of issues. If I'm a small business owner and I really want to attract some great people, is offering them insurance either through an exchange or inviting them to go onto an exchange, is that the way to really attract some quality people to work for my small business?
That is a very important quality to have if you're attracting employees.
But can I afford it?
Well, I like to say there are many options out there. You have a commercial, you can go individual, there's private exchanges, there's the Avenue H, the small business shop exchange. I almost think you actually have more options now than you did before. And the issue of guarantee issue now in the individual market as well as small group, and they've made modifications. There's actually more flexibility now than before. So if you wanted to start sponsoring plans, then definitely start looking. And it's not like there's just a few plans to pick from. We have 4 different metal levels. The bronze level plan can be very cost effective for a small budget firm, and researching the market and seeing what all your options are. That's the most important step.
Let me ask you, Andrew, did you want to add something to that?
Yes,
Please
if
do.
I may. Something rather fundamental is changing right now, and it is that typically the value of getting insurance through your employer was that you didn't have to go to the individual market and shop for it. If you were someone that had a history of cancer in your family, or if you were a diabetic, that was a very expensive route for you to go to the individual market, where your risk would be priced based on your own family history and your response to the application. What's changing right now is that the risk that typically was priced by individual is being pooled together in these new exchanges for individuals. So if my employer doesn't offer me insurance, I have a better option today than I did in the past to go get that insurance that's community rated, that's guaranteed to be provided to me regardless of my health status, and that didn't exist in the past. So employers now, yes, it still matters that you provide insurance to your employees, and yes, that's still a benefit, but if you don't provide that, and perhaps in lieu offered a higher salary, those employees could go to the exchange and have options that they didn't have in the past.
Okay. You bring up the exchanges. We're all aware of the challenges that the exchanges are going through right now. Nathan, should this be a concern to the small business owner right now, knowing people may, they're saying, well, go to the exchanges, you'll get that, but the exchange is not working, and I need insurance come January 1st. Is that a concern?
It absolutely is a concern. It's a big concern for people today, especially if they're looking at that individual market. All I can tell you is they've told us it'll be up by November 30th. We all hope that it is. If not, there are still options for you. Whether it's your small business exchanges that you would go through. Our small business shop exchange in the state is working. It is functioning and is doing what it should. It's the individual one we're having trouble with today.
And is the business exchange, Avenue H, that is not available to individuals? Is that just for small business?
Just for small business, 50 employees or below.
How much does small business even know about Avenue H?
They know about it. They've written several thousand policies over the years through Avenue H. Most of the brokers know about it. You do need a broker in order to utilize Avenue H as they help you work through it. And so it's known about. I know recently with their relaunch and what they're doing, they're advertising quite a bit. And I think they'll gain some traction this year.
How about, I want to go back, and I want to ask Robin, for the employee themselves, working for a small business, what are the benefits now that HCA makes available to me?
There are actually several features that are helpful to especially a small group. The most interesting one, I believe, is the removal of pre-existing limitations. Currently, actually in 2013, if you did not have coverage before you go on your group plan, then you might have a limitation for up to 18 months. Well, that's no longer in place. So once your plan renews, it doesn't matter if you had coverage or if you had an issue, if you have a health condition, that you will be accepted and that will be covered, period. So that's really important. The other is the expansion of preventive care. So they really are driving home, go get checked, have your cancer screenings, take that medication that for preventive purposes, and most of the time that is zero copay, no cost share to the employee.
All right, so there's a benefit for sure.
Definitely. As well, actually, not a lot of people know about this, but the mental health benefit in 2014 is much more comprehensive than it ever has been before. So many small group plans have a very, very limited mental health benefit, so that's an enhancement as well.
An enhancement as well. Well, we continue with our live town hall meeting. It is chance if you're listening, driving home tonight, you're a small business owner, you have a question, 888-570-8010 is the number to call, 888-570-8010. You can text us at 59570 or email us at rod@knrs.com. More questions coming up, your questions as well. Our live town hall meeting, the impact on small business of the Affordable Care Act. More coming up on Talk Radio 105.7 FM, 570 AM.
We're listening to a live town hall meeting on the impacts of Obamacare on small business owners, presented by Arches Health Plan, the way healthcare gets better.
All right, welcome back to our live town hall meeting. Our guest tonight here on Talk Radio 105.7 FM, 570 AM, Robin Sellers, an account executive with Fringe Benefit Analyst, Nathan Johns, the Chief Financial Officer with Arches Health Plan, and Andrew Croshaw. He is a partner and managing director at Levitt Partners. So many issues to talk about on small business. Again, we open up the phones to you. If you have a question, 888-570-8010, or you can text us at 5950. Now, the question about that arose immediately during our break was small business tax credits, because under the Affordable Care Act, there are some tax credits available. Robin, do you want to tackle that one?
Yes, definitely. It's really important to understand the small business tax credit is only available through Avenue H starting in 2014, but they've actually expanded it, so it's more flexible for that credit. Essentially, if you have no more than 25 full-time equivalent employees and your average salary is below $50,000 a year, then you can qualify for a significant portion of what you are contributing to the premiums for your employees.
So you get a tax credit, is that correct?
Yes, when you would file your taxes in 2014, that would be a tax credit to the company.
All right, what if I have more than 25 employees but under 50 employees? Is there a different category for that?
There's only one tax credit, and it's for the under 25 employee groups.
Okay, so over 25, no
over
tax
25,
credit.
No tax credit.
Will that tax credit continue after 2014? I mean, will it go into 2015, 2016?
The tax credit has actually been in place now for 2 years. I estimate it will be in place. My guess is that it will be smaller. That's, again, a total guess for me. But when we bring up taxes, it's important to remember when you are running your medical plan through a group, you can do pre-tax on your employees, do a pre-tax on their portion of the premiums, and the group also can do some reductions on their taxes as well. So there is in place a tax benefit for running through group plan.
Could the tax credit be taken away?
It could, yes.
I mean,
I know we're dealing with the IRS
we're
here, so
we're the IRS and the federal government, right? So that
we all
could
know
be
there's
taken
changes.
care.
Yeah,
it could be taken away.
It could be
All
taken
right.
away.
Nathan, I want to ask you. There's, Robin brought up the point: the 25 employee, the 50 employee, the over 50 employee. How does the government, under the Affordable Care Act now, define what an employee is? Is it hour-based? How is it defined?
Today, for purposes of small business and large business, it's a full-time equivalent.
Explain that.
Essentially,
that's lingo, jargon. What is it?
A full-time equivalent, or an FTE. Essentially, those employees who are not full-time employees, you need to add up their total hours and divide it by roughly 2,080 hours a year, which is a 40-hour work week for 52 weeks, to determine your full-time equivalent employees and how many of them you really have.
So if I'm 30 hours, am I a full-time employee? Am I 29 and a half?
No, your 40 hours a week is a full-time employee, and for any of those that are below that, you start adding up hours and looking at how many equivalents you really get to.
All right. Now, Andrew, I want to ask you, we talked about this during the break as well. There's a real debate. I have 51 employees. I have 60 or 65 employees. What is the debate over there? Am I considered now a large business if I go over that 50 threshold?
So yes, you are. If you have more than 50 full-time equivalents, you then are responsible to make sure that you are providing a certain level of coverage to your employees. If your employees are paying more than a specified percentage of their income, and it really that percentage changes based on the salary you pay them, and they go find insurance through one of the other exchange options that are available to them, you'll pay a penalty for that employee having gone. You'll also pay penalties if the insurance coverage you're providing doesn't match up with the standards that the federal government has set. So for employers that are slightly larger than 50, there's a real urgency to figure out whether they're in compliance. And what we are seeing right now is in the private sector, employers that are larger than 50 are beginning to look at new ways of delivering insurance to their employees. And that includes exchanges in the private sector. You have private companies out there who are arranging for multiple carriers to come in and serve multiple employers. This allows employers to continue to provide coverage, but take a little bit of a step back from being so involved in deciding what the benefits are and being involved in creating wellness programs and those kinds of things for employees. And we're seeing right now a lot of employers give a second look. Even some very large employers. Walgreens put many of their employees in this. Darden Restaurants has begun using it. Many large employers are thinking about how to more effectively continue to provide insurance coverage for their employees and get out of the unpredictability that they've been facing in the rising cost of health insurance.
I want to get into that maybe in the next segment because I've heard this term self-insured. And some people have talked about being self-insured or a company being self-insured. We'll get into that, but I want to go back to this question about the employees. I'll share a story with you this and how this happens. I was talking with a gentleman I know the other day. He was in the drywall business for a long, long time. Very successful business, had sold it, went on to other things. He ran into an individual who has a drywall company, 98 employees, so he would be considered a large employer right now. He said, as I'm looking at my insurance for next year, for my 98 employees, it is going to increase additional expenses to me of $330,000. He says, look, I only make about $200,000 a year off the business. How do I pay for that? Is that true, and how does that happen? Nathan, ideas, or maybe Robin, how is that happening out there?
We are seeing rates go up. Under the Affordable Care Act, there are new requirements for coverage that are included in the policies. As we talked about earlier, mental health is one of those. Maternity is in every policy, those kind of things. And we are seeing rates go up for those coverages. Some employers are seeing some very excessive rate increases. And I think a lot of that is due to where we're moving to this community rating. Instead of asking the medical questions anymore, everyone's rated on the same scale. Insurers are being cautious, not wanting to take on groups that are more risky than others. There are options. Shop it around. Look for other carriers that are providing you quotes in what you can do. Have your broker bring in additional quotes. We had one the other day for a municipality that we were working with at Arches, and we were able to actually give them a decrease from what they are currently paying. No one has seen a decrease in rates for many, many years, but we actually offered them a 7% decrease from the rates that they currently have. There's another company I talked to just last week, 100 employees. They got a 30% rate increase. And that was painful to them. The president of the company was saying, that goes straight to my bottom line. What am I going to do? There are other options out there. There are ways to look at quotes and plan designs that may help to control some of those increases for them.
When you control those increases, I mean, is the best advice, like you were just saying, Nathan, shop around, see what is out there. But if I'm an employer, I'm going, who do I go to help shop me around?
I think that's a great first step, is to shop it around. And the best place to start with that is your broker community. Talk to your broker. And if they're not answering your questions, there's other brokers out there that will. There's very good ones that can help you with that question.
Okay. Robin, what do you, for those employers, what are your thoughts on this?
I think one of the most important things to consider is, first of all, I'm going to start off. We have had a problem in America with cost. And unfortunately, healthcare reform did not specifically address the reason we have a cost problem. We have unhealthy Americans, and we have medications.
Wait a minute, I look out here, I see nothing but healthy Americans right now.
Well, we're getting a little sicker as we get a little older. We have lots of new kinds of treatments, medications. All these drive cost. Healthcare reform did a good job at shaking up the market. I'm not saying that it solved the problem, but at least it has driven it down a different road. So here we are. If you are a group that's receiving a significant increase in 2014, it's probably because you had been benefiting from smaller rates historically, because maybe you're healthy or younger, and the community rating is going to bring you up to average. That's just one of the reasons. But essentially, things you didn't consider before, like self-insurance or private exchanges or bringing a high deductible health plan to your employee, those all need to be looked at. because essentially pricing is different this year than it was ever before. So everything's priced in a different manner. If you live in a different zip code, I mean, you could be living in St. George or Ogden and have completely different prices. And that matters now, where it didn't matter before. So look at it again. If you tried Blue Cross before and it was not rating very well for you, it might change. It probably will. So try it again.
Andrew, I heard the other day someone talking about this is a time of year where insurance companies are actually setting their rates for the coming year or future years. Is that true? And how is that impacting things right now? I see Nathan over there shaking his head. But is that true, and how could it impact insurance rates in the future?
Well, insurance companies are really being, it's probably fair to say, squeezed by this law. Historically, the insurance business is somewhat cyclical, and so insurance companies will look at their book of business and create premiums that they think will cover the cost that they anticipate. Sometimes they're right and sometimes they're wrong. And so historically, if they're wrong, they'll raise premiums in the future in order to make back some of the money that they lost. This law essentially took away some of that privilege from health plans. If they end up spending less than 85% of the money that they collect in premium on health care benefits for those people, they have to refund that back. So the ability to go through a natural underwriting cycle and recover losses from last years has been taken.
It's gone.
Another challenge that health plans face in pricing risk is that we know that those without insurance who are most likely to come in the door for insurance will be those who most need it. The sick, the old, those who have been locked out, if you will, of the insurance market. If there isn't a long line of healthy people that also come through that door, then as insurance companies begin covering the cost of care in 2014 for this new population, and it's really a heavily concentrated unhealthy population, that will factor heavily into the premiums that these insurance companies charge next year. Now, if that happens, we'll be in a downward spiral because next year insurance will be more expensive and the only people likely to come will be the extremely sick who will benefit, and so we go down the road till the market collapses.
That's not a rosy picture you're painting, Andrew. That scares the daylights out of me, to be real honest. Let me ask you, Nathan, in this, and that Andrew was talking about this, the pre-existing conditions, the impact that's having, because no longer can pre-existing conditions will not keep you out of the insurance market. How much, in fact, is that having an impact, not only on the individual insurance, but also on small business and larger businesses?
It definitely does have an impact, as now we're on this community rating model. You don't get to ask the healthcare questions any longer, or define that individual or group risk that comes with a group.
And before you go, did that make a big difference before?
Yes. Before,
why?
You used to be able to file a rate with the state Department of Insurance, and you could increase that rate up to 85% depending on the wellness of the individual or the group that you were quoting and talking to. Today, our rates across the state were set back in April. Whatever rates we filed with the Department of Insurance as carriers in the state of Utah were set in April, and we cannot change them for next year. We're locked into those rates, and we're going forward with them. The same thing's going to happen in 2014. April of 2014, we will file our rates and plans with the Department of Insurance, and they're locked in until 2015. We're stuck with them. And so, as Andrew was saying, this pre-existing condition, we don't get to ask those questions and do those things. There's some benefits to that for the individuals and those who had those pre-existing conditions. But it does make it a little bit of a guessing game for the insurance carrier on how do they price this to make sure they don't take too many losses.
Has there ever been a time when insurance rates have actually gone down?
I
just roll that out there. I mean,
not that I can remember.
It's very rare, and like Robin said, this is called the Patient Protection and Affordable Care Act, and that's not because care has fundamentally become more affordable. It's because there are now government payments to subsidize the cost of what is really escalating care, and thereby making it affordable for the individual. That comes by making more people eligible for Medicaid and by providing subsidies for many people to buy insurance in the private market.
Well, we need to take another break, a limited break here, as we continue with our town hall meeting on the Affordable Care Act and its impact on small business. Again, if you have a question, 888-570-8010, or you can text us at 59570. We'll continue with our town hall meeting right here, the Rod Arquette Show on Talk Radio 105.7 FM, 570 AM.
Live town hall meeting on the Affordable Care Act, Obamacare, and how it affects your small business. Presented by Fringe Benefit Analysts, simplifying the Affordable Care Act for you and your business.
All right, welcome back to our live town hall meeting on the Affordable Care Act, its impact on small business. Let me introduce our panelists again here on the Rod Arquette Show and Talk Radio 105.7 FM, 570 AM. Andrew Croshaw. Andrew is a partner and managing director at Levitt Partners. Nathan Johns, chief financial officer at Arches Health Plan. And back with us again is Robin Sellers, an account executive with Fringe Benefit Analyst. Before we started the show, I got a text message from someone, Robin, asking about additional fees, hidden fees that small business should be aware of. Are there fees out there that they may or may not be aware of and that could hit them?
Yes, there are actually 3 new taxes that one of them have already started, the PCORI fee. The 2 that the small businesses will start be feeling in 2014 is the health insurance tax, and this is a straight approximately 2% on your premiums, like a sales tax, and that will be starting in January. Every carrier is handling it a little differently. It will either be built into your rates or show up on your premium statement. Either way, it starts in January. The other one is the reinsurance fee, and that's an attempt to stabilize some of the unsurety in the market, and that varies by carrier, but it's approximately, now the amount spaces from my $2 per, I'm sorry, I'll look it up. But
someone out there shaking their head. Yeah, you're right.
There's an additional fee per member. So every member, it's $5.25 per member per month. So if you have 7 people in your family, okay. $35 dollars. Yeah. So that's built in right on top of them as well. So both of those are actually substantial. That's, a 3 to 4% increase automatically.
Okay. Let me ask you, Andrew, from an employee perspective, does this plan help me in the sense that once I buy my insurance in an exchange, I'm working for a small business, I go to another small business, that insurance carries over, does it not? I don't lose that now because I'm changing employees or employers. Is that correct?
Not necessarily. There certainly is more portability of insurance by virtue of this bill. But it isn't necessarily the case. So right now, Utah actually has one of the better small business exchanges. Our employers in this state can do a defined contribution for their employees. They can allow their employees to choose among several plans. If we were in a state that hadn't had the forethought to build a small business exchange, our small business exchange would be the one offered by the federal government. And in that one, the employer picks the plan, all the employees have to go with that plan, and the employer can't do a defined contribution today. That may change in the future, but our exchange is much better for employees. It's possible that if I were to leave my employer and go to another employer that's also using the exchange, I could find my same plan again, but I don't have, there isn't any sort of guaranteed portability yet, but we're on our way to more portability, based on where we've been in the past.
Nathan, let me ask you, I'm a small business. I have 23 employees, 17 in Utah, I have 6 up in Idaho. Does one plan cover them all, or am I getting different plans out here?
If you're an employer with 23 employees, you're probably going to only offer one plan.
And does it cover them in both states?
It will cover them in multiple states. It can go outside the state if the majority of the employees are in the state of Utah. The statutes allow for that. But what you're going to find is that plan that you choose as the business owner may not work for your employees. As a small group, that's one of the challenges you face is by choosing what is the right plan. Whereas, as Andrew was saying, if you go through our shop, Avenue H, you define what you're going to pay, and the employees can pick whatever plan works best for them, and they pay the difference of the cost of that plan out of their own paycheck.
If I'm a small employer, okay, and I decide I'm not going to offer insurance to my employees, and they go out and shop the exchanges, and all of them have maybe different plans or variations of those plans. As a small employer, do I need to worry about anything, Robin?
Well, the number one thing I would say is not everyone in your group is going to qualify for a subsidy. If they go to the federal marketplace, chances are they could find a similarly priced product either with the group or not in the exchange. When you have an individual product, you lose the pre-tax savings of that. And especially your higher earners, they're probably not going to be happy that they lost their employer contribution and are paying more taxes now. Okay. So that's probably one of the number one concerns.
Robin's exactly right. There is one additional consideration to discuss, and that is that it's possible for an employer to raise the salary of an employee, since if they're a small employer, they're not going to be fined, and they're going to save a lot of money by getting out of the insurance business. So they could afford to offer a bump in salary to their employees, send those employees out to the exchange. As Robin said, some of them won't find any subsidy there. Some of them will. So the employees could actually get cheaper insurance, get more pay from their employer, and they're better off. The employees that don't qualify for a subsidy, just as she said, they'd be in the business of paying a little more tax, but potentially have more income too. So the way this all works is that there's a bunch of extra money out there that's available for individuals that make less than 4 times the federal poverty level. For a family of 4, that can be quite a nice amount of money, $90,000 or so.
But if I get a significant raise from my employer, because now he's not having to worry about my insurance, does that take me out of that subsidy range as well? Am I okay? I don't get the subsidy anymore because now I'm making too much money. Is that possible?
It's theoretically possible. It's not likely because unless you're right on the fringe of the subsidies, they are sliding scale subsidies that go up to 400% of the FPL of the federal poverty level. So, it was estimated that of the 7 million people that would enroll in these exchanges the first year, that 6 million of them would be eligible for subsidies. Now I'm talking about the individual market. So the government estimated that 6 out of 7 people would be eligible for a subsidy. So they are not narrow subsidies in the individual market.
Okay. Nathan, well, Andrew was talking. I saw you, with the microphone. You wanted to add something to what he was saying.
That is those individuals now have a broader choice of plans that they may want to pick also. Rather than if you're the small employer with 23 employees, most carriers are going to allow you to offer 1 plan, maybe 2 if you're lucky. But that means 1 or 2 plans have to cover what every employee needs, and that may not be the best solution for them. The choice that's available in these exchanges, whether the small business one or the individual, is far greater than what small business owners have had today.
Robin, you want to add to that?
I have to say I disagree with several things that have been said. First of all,
good.
It's important to note that both the shop exchange and the federal marketplace have limited networks. So you can buy...
So what do you mean by that?
The available plan for Blue Cross available on the federal marketplace is Focal Point Network. It's their smallest network. In the commercial and both individual and small group, you have 3 networks available to you. So I wouldn't say that the small group market has the most available choices. I would actually say it has the least.
Robin, I'd have to disagree with you on that one. Knowing the plans that we've put together, we have our broad network in all markets available to all people.
Right.
And I know you're focusing on Blue Cross, but they're not in any of the exchanges in the state of Utah.
They actually are. They're named something different, but you're right. Arches is one of the only carriers that is offering all their networks, and that's great because, honestly, we need to have more flexibility.
This term network, does that mean a health plan?
It's the facilities available.
Okay.
The providers available.
There's so much terminology out there. You people are experts in it, you understand, but I think for the people out there, they're going, what do you mean by network? What do I mean by, I think you used the term FPL. I mean, what does all of this mean? If I'm a small business owner and I just want to understand the language to begin with, what should I do?
There's several websites you can go to find those different things. I would recommend archeshealth.org. I think it's a great one. We've got a lot of definitions out there. But I also have to say...
We'll charge you for that plug after the show is over.
Talk to your broker. The brokers know what's going on. They've received a lot of training and education from the different carriers as to what's available, and your brokers can be a great resource for you.
And the final thing I kind of wanted to add is, if you are in fact a healthy small group, self-insurance may be an option for you next year, and pricing should be done. And an individual does not have that option available to them. So I just throw that out there as a possibility for small groups.
You teed it up perfectly for me because we need to take a break. But when we come back, I want to talk about this idea of self-funded plans, because it is being talked about out there, the benefits. Should a small business look at this possibility? Is it better for large businesses? So we'll talk about that when we come back. As we continue with our live town hall meeting, the impact of the Affordable Care Act on small business. More coming up on Talk Radio 105.7 FM, 570 AM.
What does Obamacare mean to you? You're listening to a live town hall meeting about the Affordable Care Act on Talk Radio 105.7 FM, 570 AM.
All right, welcome back. Final segment of our live town hall meeting on the Affordable Care Act and its impact on small business. I'm the host of the show, Rod Arquette. Thank you for listening. Andrew Croshaw from Levitt Partners is here. Nathan Johns from Arches Health Plan, along with Robin Sellers from Fringe Benefit Analysts, talking about your questions, taking your questions, and the impact of the Affordable Care Act on small business. We touched on this before the break, and I keep on hearing this term coming up now more and more about self-funded plans. What is a self-funded plan, and is it a benefit? Is it something that small business should stay away from? Let's begin with Rob. What is, first of all, self-funded plans?
A self-insured plan or self-funded plan is the group, the employer, takes responsibility for the claims. The carrier at that point just is administering the plan. You pay every claim that comes in the door. A group would typically buy stop-loss coverage to act as a major umbrella coverage in the event they had a claim $100,000. They wouldn't go out of business. It wouldn't be covered by that specific that specific coverage. Typically, when you have a group below 200, carriers are very concerned. There's a lot of risk there. You have a good year, you have a bad year. It's hard to anticipate what's going to happen. And carriers typically won't venture far below 200 very often. But because of healthcare reform and the additional restrictions placed on a group plan and what's required, some of those things can be waived if you have a self-insured plan. One of the taxes you do not pay. You don't have to worry about community rating. You can rate for health. And so if you're a healthy group that's typically, over or around 50, a carrier may actually offer you a self-insured product where they didn't before.
Okay. Too risky, Nathan, for small business?
When you get down to below 50, I think it is quite a risky venture.
Why?
The average statistics are out of 5 years of doing a self-insured plan, 2 years you'll come out fine, 1 year you'll break even, and 2 years you'll lose money. Well, if you lose money in the first 2 years, you're really going to be upside down. You, as the employer, are now carrying the risk to pay for the claims that your group incurs. And that can carry a lot of risk with it. You're a small population, and you just don't have the law of large numbers that an insurance carrier does to help you predict what type of cases you're going to have.
Why would that be attracted to small business, or is it? Are there any small businesses that have self-funded plans now that you're aware of, and why would it be attracted to them?
There are small businesses that do. There are carriers who will write self-insured plans down to a very low number. I've heard 25, even down to 15 employees. If you are rolling in the cash, it may be a way for you to save money on your premiums and do something for your employees. If you're a company that has been making the same amount every year, year after year, you may not want to take on that risk.
Thoughts on it, Andrew? Any additional thoughts on self-funded or self-insured plans?
I agree with what my colleagues here on the panel have said. You as an employer, there's a cost associated with taking risk, and if you're willing to take the risk for all the sum of all the hospital visits and all the doctor visits for your employees, your monthly premium will be much lower. But you do have exposure, and so even predating the passage of this bill, there has been a trend of employers who could moving to self-insurance to try to escape some of the annual escalating cost and premium. And as was pointed out, there is risk associated with that. Ironically, we've talked a little bit today about this movement towards private exchanges, where self-insured employers get together, pool their lives, and offer an exchange to their employees. And this is a phenomenon really just of the last 12 to 18 months that we're seeing. Ironically, in some of those private exchange environments, employers are moving back to full insurance, where the exchange itself takes the risk and the employer is just saying, look, we can afford to pay $500 a month towards your insurance. And that's our contribution. And if insurance prices go up, they go up. But that's what we can afford to pay. And so they're moving back to full insurance in the case of these private exchanges.
And for a small business, is that a good idea? And are private exchanges forming? Are they out there now? Like you said, it's a fairly new thing that's developed. Is this something that private business should consider self-funded through a private exchange?
Small employers, not so much. In effect, the shop exchange that we have in Utah is the option for small employers. I'm really speaking of the employers that are ineligible to participate in the shop exchange and other federal equivalents around the country. The more than 50 employer size that's participating in these private exchanges.
Robin, any additional thoughts there?
There are many private exchanges out there, and I always give the same message, no matter if we're talking about a new plan design, a new carrier, a new funding mechanism. Proceed carefully. Make sure you cover all of your risk, and the more options we have, the better. I hope that they all exceed well. I hope we have 10 or 12 different options in 6 months. That I think would be a better scenario. But really what it comes down to is you need to make sure you've covered all your risk. And just kind of a side note to the self-funding, the funding mechanism, the reason it won't work out for everyone, the carriers make you fund to your max liability. And if you're an unhealthy group, that will probably exceed your premium amount. But if you're a healthy group and you end up having a great year, you would get a refund at the end of the year.
Okay. I want to, before we wrap up tonight, I know there are some things that probably small business needs to do before 2014 and probably to prepare for 2015 as well. But Andrew, you brought up a point I want to talk about. There is a debate right now. No decision has been made about Medicaid expansion here in the state. But you were mentioning that small business could be impacted by this if, in fact, the governor decides to do this. How would they be impacted? Do we know yet?
Sure. Well, we know that there are people that would be. So first of all, let's just for the listeners clarify that the eligibility for Medicaid has been expanded under this bill. It's a part of the bill that we haven't spent much time talking about tonight. So you can now be childless adults making up to 138% of this federal poverty level that we've mentioned and be eligible for Medicaid. So if this state decides to expand Medicaid, you've got a number of those people who are receiving insurance from their employer today who would be eligible for Medicaid if Governor Herbert decided to expand it. That, plus the fact that you now have an individual marketplace that is guaranteed issue and risk pooled, creates in effect an outlet for employers to stop providing insurance, small employers especially, to stop providing insurance and let their employees go to Medicaid or to the exchange where they can get a subsidy and potentially be as well or better off. That is serious business because it is a fairly massive transformation in who pays for health care. Hospitals today look very carefully at their what they call their payer mix. Medicaid is a rather poor payer for them compared to what they get paid from the private sector. So if we see an implosion, if you will, a collapse of the small employer insurance market, the payer mix for hospitals is going to change rather significantly and not to their benefit.
So we're starting to see that now, are we not? In some of the cases, I hear stories where instead of going through the exchanges, people are just opting to go into Medicaid. Isn't that already starting to take place?
Certainly for individuals who are going to the exchange, they go through a process where their eligibility is tested for Medicaid as well as for subsidies in the exchange. And to date, given all the problems that have happened with the website, far more people 3-to-1, 4-to-1 ratio are ending up in Medicaid as opposed to ending up in the insurance exchange. And that's really a testament to who's first through the door. The people who are least healthy, who are most in need of insurance, they're the ones waiting to go through that door, and many of them find their way to Medicaid because of their eligibility.
All right, we've got just about a minute and a half left before we need to wrap it up tonight. But I want to start with Nathan first of all. 2014 is coming. It's about 6-7 weeks away now. Are there things I better get done if I'm a small business owner before 2014 arrives?
If you're a small business owner that currently offers insurance, I would definitely take a look at your plan, get your renewal rates, see what your rates are going to be for next year, and sit down and have a discussion with yourself and key advisors as to what you're going to do. Your renewal cycle on the 12-month cycle will come around, and you can make those choices of whether to renew your plan or go through the calculations and look at sending your employees into the individual exchanges.
Robin, what should I be doing? 2014 is just around the corner.
I'm just going to highlight one thing that a lot of people don't know about. There's a new requirement that an employer send out a summary of benefit and coverage during your open enrollment period. So whenever your open enrollment period happens, make sure that document is being distributed. There's some significant penalties if it isn't. So follow the distribution of ERISA and get those notices out to your employees.
All right. Well, Nathan, Andrew, Robin, you have been great. We appreciate it. Thank you, everybody, for joining us on our live town hall meeting. We'll be back tomorrow with a brand new edition of the Rod Arquette Show. Have a great evening.
You've been listening to a live town hall meeting on the Affordable Care Act and how it affects your small business and your employees. The town hall meeting has been presented by Fringe Benefit Analysts, simplifying the Affordable Care Act for you and your business, and by Arch's Health Plan, the way healthcare gets better. This has been a special presentation of Talk Radio 105.7 FM, 570 AM.